Hello, my name is Dr. Linda Stein Gold, and I'm the Director of Dermatology Clinical Research at Henry Ford Health in Detroit, Michigan. I'm also a medical dermatologist, and I was involved in the phase 3 clinical trials with Tapinarof in atopic dermatitis. When we think about atopic dermatitis and the treatment, especially with topical therapy, I think of topical steroids as a short-term solution to a long-term problem. We know we can't use them over the long term because they're side effects. They're not good for you to use long term. As an acute treatment, often we'll reach for them, but we need a medication that gets patients under control and keeps them under control. And we also want to be able to simplify the treatment regimen. What we found with Tapinarof, especially in our younger atopic patients, is that this is a medication that helps to simplify the treatment regimen. We can use it when the patient is having an acute episode. We can use it for the long term. So it's something that they can use on the face, they can use it around the eyes, they can use it on the thick areas, they can use it over time. And it actually has that kind of triad in my mind that it works well up front, it works for maintenance, but it's also well tolerated and shown to be safe. The side effects that we saw in the clinical trials were infrequent, and generally they were mild or moderate. When we look at the folliculitis, often it went away without any treatment at all. Sometimes patients would just stop using the medication to the affected areas that developed a folliculitis. So I just tell patients that if there's any problems, stop using the medication to that area, maybe take a drug holiday. There's no one treatment that was found to treat the folliculitis, but I've seen in my atopic patients, I've seen this very infrequently, and a lot of times it just goes away on its own. It's important that we continue to do research and development for our patients with atopic dermatitis. Our pediatric patients don't have that many treatment options, so it's really important to have new non-steroidal options. I hope we continue to see more and more innovative research, and I'm glad that we have Tapinarof, especially for our younger patients.